Doctors of Reddit, what's it like when you go in for a doctor's appointment? Do you and your doctor discuss what's wrong with you like it's a group project? Do you not go at all because you're your own doctor? I was at a lecture a couple of years ago, performed by two doctors who'd undergone treatment for breast cancer and written a book about it together. I remember her talking about her diagnosis. She was a breast cancer surgeon herself, you couldn't make it up. She walked into the room, saw her own scans with the doctor and her heart dropped. She barely heard a word he said because she couldn't stop the flood of information she was getting. Looking at the scan, she knew if she'd need surgery, chemo, radiotherapy, how long it would be, what her estimated survival was. I don't think they discussed it like a group project, but I suppose she couldn't stop herself from listening to her own internal monologue since it was her own field. I remember her saying she'd found it, in hindsight, an incredible learning opportunity regarding how to interact with patients, and that she thought about it a lot. What's her name and her book? I'm not op, but it could be Professor Tricia Greenhalgh and Dr. Liz O'Riordan? See here for Dr. O'Riordan's website. That's the one. It depends on what I'm going in for. As a background, I'm an oncologist, so I've trained in internal medicine before. For most internal medicine type stuff, I don't bother going in unless I need something that I can't easily get for myself, for example labs or images. For specialty stuff I wasn't trained in, I go in and try to give them the best history I can, but let them do their own thing. Internet high five from an oncology patient, thanks for doing what you do. Chiming in to agree with the other poster. My son had cancer and his DRS were amazing and kind. You really look to your oncologist for answers, and sometimes, hope. So, thank you for what you do. Part of why I, and many others, went into the field was for the especially close relationships we can forge with our patients, and what we can do for them during an incomparably tough time in their lives. So, it's our pleasure. I don't get involved in the management. I let the doctor seeing me lead that, unless they miss something huge and I would just double check. The main difference is I can present the whole history and relevant info in about 30 seconds flat, and the doctor with that info can just give me the management plan in about the same time. Fastest consultations ever. Very methodical. The main difference is I can present the whole history and relevant info in about 30 seconds flat, and the doctor with that info can just give me the management plan in about the same time. Oh man, I'd like to be able to do that. I have a pretty extensive medical history, and with new MDs I go in with a type up, but I'd love to have an elevator pitch down. I think it takes me about 2 to 3 minutes currently. 2 to 3 minutes is great as well. It beats the patient who has a 10-minute slot and tells you about their pet cat for the first 5 Or the patient who denies their own medical history. Do you know or have you ever had any heart problems? Know what's that scar on your chest from? My triple bypass AUG. The classic do you any medical conditions, know what medicines are you on, Ramipril. Facepalm management plan, getting to a healthy weight will help same patient, drive, am not stupid let's not state the obvious me and me head, really. And do you smoke? No. Have you ever smoked? Yes. When did you quit? Tuesday. Me, you just said you're on Ramipril but you said you have no medical conditions. Are you sure you don't have high blood pressure? Patient, I don't have high blood pressure. The tablets made it disappear. LOL. I have immense sympathy for my dentist for stuff like this. Patient fills out a medical questionnaire as no issues, no medication. Dentist asks again about conditions and medication, gets an irritated no and did you read the form as a reply. Patient needs a tooth pulled, has to sign a consent form that again asks to list medication. Patient is now angry. 5 minutes after pulling the tooth, patient asks if their Coumadin prescription will affect their ability to stop bleeding. This is not a unique story. I have been a dental hygienist for 15 years and this almost always happens, or I verbally review the patient's med checks and they tell me nothing is different. Then the doctor walks in, they tell the doctor they were hospitalized last month for chest pain or a knee replacement, but I don't see what that has to do with my teeth. I ask the patient about any med checks changes and they say, nothing you need to know. I ask the patient if they've been experiencing any dental issues, they say no. Then I look and see fractured teeth or a fistula, oh, that's been there for a month. I ask them if they've had any dental issues and they say no. Then I see bleeding and ask them about it and they say, oh, that happens all the time. Patients, man. I'm a great dental patient, but a terrible medical patient in that I never go to the doctor, so. Haha, Real conversation I had when my son needed glasses. Me, I can't believe you need glasses. I wonder where you got bad vision from since mine is 20/20? Son, didn't you have LASIK? Me, oh yeah. Doctor here, neurologist. I'm not good at going to the doctor. I don't go often, but when I do I usually just STFU, especially if it's a field of medicine I have no idea about, like say, derm. That being said, the doctor usually knows I'm a physician as well, and so the language terms to be more technical. I also find that we practice less defensively with each other since we can be more open. We could do ABC tests, but honestly what you probably have is X, so take this, and if it doesn't get better then we can do ABC. Real question is, do you understand the prescription the other doctor writes? We don't really write prescriptions much anymore. Usually it's computer generated. Best change ever emo. Now I know what I'm getting before I get the pills. Gives me a fantastic opportunity to Google the pills and catastrophize before I even take them. I mean, only if you're paranoid. I research every drug I'm given. I want to know what they actually do and how they do it before I take them. Nothing wrong with being informed, plus it means if you have any questions you can ask your doctor about it. I had an issue with the insurance company prescribing a generic Prilosec, so I had to get a different antacid. Second prescription came in, bought it, Googled it before I took it. Got prescribed a laxative instead. Thank God I looked, I would have been in a world of pain. I don't give a shit what the insurance company wants to push, it doesn't work for me. You will give a shit prescribes laxatives. Took me a minute to realize this is a handwriting joke. 2.5 milligrams of Rumblbril. IOMGLBLBLBLOL. Is there a subreddit for doctors' handwriting? Probably not very HIPAA or data friendly. My doctor writes a single wavy line, like that, tilde 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 tilde. I have no idea how pharmacists decipher that. It cures what ails ya. My dad used to be a pharmacist in India, so he could decipher any doctor's handwriting. I sometimes send him prescriptions given to me by my doctors in US and he can read them too. At this point, my conclusion is that the doctors and pharmacists worldwide have a secret union where they learn a secret language. What's the reason for the defensiveness when seeing regular patients? Is it to prevent them getting overly anxious about what might be the cause for XYZ? I'm currently being checked out to find the reason for my autonomic dysfunction, and the lack of transparency about the process is maddening. I would honestly prefer being told what and why they're suspecting something or just looking to rule stuff out, rather than looking up the tests, and sometimes results, myself and seeing a list of cancers or other terrible diseases. That for sure will make me wondering about what's going on. So just because a similar question has been asked multiple times, hopefully this is seen and it answers it for the patient's side. Truth of the matter is I always do this. I always try to level with patients and explain things as best I can, and I try to simplify to the point most people would understand. I like to think I'm good at it. That being said, with my particular field, neuro, this is quite often challenging due to the nature of the central and peripheral nervous system. It's obviously easier to communicate with healthcare professionals as they may have at least some passing familiarity with most topics, even though we're not necessarily experts at it. While some doctors are very afraid of lawsuits and litigiousness, I personally am not seeing patients that way. Maybe it's my youth, who knows? At least from a neurologic standpoint, a misdiagnosis can be devastating in some circumstances, and in others can be quite annoying/life-changing. For example, being told you have epilepsy and then it turns out you have pseudoseizures, which is the difference between a neurologic and psychiatric diagnosis. This can be very jarring, and I run into issues like this often. Therefore, we try to be thorough with excluding things. I understand that when it comes to the brain it's usually a very stressful and anxious experience to see me, and this can have emotions run high, especially since, like I said, neurological conditions are either a quirk/annoyance, or devastating with very little in the middle. Just wanted to say thank you for one of the more original Ask Reddit questions I've seen in quite a while. Really interesting subject. The pace and density of the conversations is different, I'm sure. I'm an emergency physician who has over time treated various physicians in my community, including internists, surgeons, radiation oncologists, some from my hospital and some not. Keep in mind that each specialty is quite different from the others. The rad-onc, for example, thinks and speak differently than the ortho surgeon, and I felt like my treatment of each of them was really quite similar to treating a professor of engineering. Academically minded people tend to ask lots of questions and research stuff while you're out of the room, as compared to populations that request a more paternalistic bent and just want you to tell them what to do so they can get on with their day. I'm careful to credit that the number of hours that went into my family physician's training are the same as mine, simply a different topic. She knows tons of stuff about management and screening for chronic disease that I don't, and I know how to intubate people, manage a bad LSD trip, or use a jar of bubbles to distinguish between kids that are scared and kids that are head injured. My mom's a GP and she usually just self-diagnoses most of the time but will sometimes get a second opinion. She doesn't really go to another doctor, just calls them to ask about stuff. Her contacts are filled with all kinds of doctors. It's like a secret underground community. For stuff like getting ultrasounds etc., then yes they do discuss stuff like it's a group project. How was it growing up for you? Did she get over every little ache and pain, or were you just told to walk it off because she's seen so much worse? Asking because I know experiences from both sides. My grandparents were both physicians and lived with us while I was growing up. Grandma was a pediatrician and Grandpa was a surgeon. Anytime I had an ache or felt sick, she would examine me, then go to her bathroom medicine tablet and bring back medicine in a little paper cup. It always made me feel better. I later found out it was always a children's Tylenol. She was faking me out with the placebo effect. If I was actually sick, my grandma would have my mom take me to another doctor, as she was no longer practicing and couldn't order tests or prescribe medication. That's actually super sweet and adorable. Yes, so wholesome. My dad is the head of my local emergency department. So I almost never went to the doctor other than to get shots or physicals for sports or for my health checkup before college, but the general rule of thumb for my household was if you're not actively dying we aren't going to the doctor. He was just capable of doing most of it himself. One time I cut open my hand pretty deep when cooking and he sewed it up in the kitchen in like 5 minutes. Looking back on it, those days were pretty crazy, but the stories he brought back from the ER are much crazier. I once lodged a toothpick halfway into my foot. I limped to the bathroom where my mom, an RN, was taking a bath. She didn't even get out, just told me to bring her some hemostats. I sat on the toilet with my foot towards her and she clamped the toothpick and jerked it out, told me to wash it and put a band-aid on it and close the door on my way out. I think our mothers studied at the same nursing school. But it hurts. Yeah, well, maybe you should be more careful next time. Get me the Neosporin and be quiet. Make sure you close the door on your way out, Mom yelled. Despite the fact she never closes your door fully herself, of course. Not super related, but I used to see this guy when I was a teen whose parents are doctors. I remember him saying that if he was ever ill his parents would essentially diagnose him and his sister and write a prescription, then just bring medicine back to them from work. Son, I can't go to school, I am sick, parent doctors. Okay. Let's check you, son. Fuck. Mom, order CAT scan, son. I just didn't want to take that test. Lol, it's funny how that works out. It really does seem like it's one or the other. I know people with doctor parents who more or less tell them to calm their shit. On the other hand, my stepmom is a pediatric emergency nurse and she is hyper paranoid about germs and safety. Like, the definition of a helicopter parent to my younger brother. My mill is a pediatric nurse. We have 2 kids and 1 on the way. It was nice to have a buffer for my pediatrician with my first kid. Like I would first go to her with my crazy first time mom things and she would reassure me with it being nothing or would encourage me to call the pediatrician. Also, now that we have multiple kids, it's really nice to have her to go with me to the ER if one is in really bad shape so my husband can stay home with the other one and I don't have to be alone. Thankfully, she knows her boundaries. She will check in on things if I asked her a question about something. But she doesn't pry into things. Wow, she sounds great. She really is. She taught Lamaze classes for years, so she was also like a doula for our first 2 births. Bummed to not be able to have her for kid number 3 because of COVID, but she has confidence in us, ha. Oh, that's so sweet. So many mill horror stories on Reddit that I'm always surprised when it's a healthy mill-dill relationship. My mom is a nurse and it was clear one Christmas day that I needed to go to the ER. She tried to do everything she could before giving in and was mostly just upset that her friend was the one on call who would have to come into work because my dumbass didn't know how to chew his food. Didn't know how to chew his food. Care to give more details? Choked on the food or what? Incredibly likely food was stuck in the esophagus. You can breath, but it gets in the way and need dealt with. Extremely common with big pieces of steak. Source: my dad is a gastro doc. You're good. That's exactly what it was, and since I was breathing, my mom kept trying what she could. Eventually went to the ER and had an endoscopy. I unfortunately got one of the quit your bullshit doctor parents. There was an uncomfortably long streak of years where I didn't miss a single day of school. The alternative isn't better, trust me. My dad is a doctor. We had a full medicine cabinet of samples and leftover RXs for everything. But we saw his medical partners as needed, and the family of his medical partners saw him. Basically everyone got free medical care as needed. I got to assist doing stitches on my mother in the living room on at least one occasion after a garden accident. I hope you get some doctors in here to give personal answers. Paul Kalanithi did address this a bit in his book When Breath Becomes Air. At first in his cancer treatment he was very involved in the decision making, and the way he described the conversation with his oncologist was more like a collaboration. Later, she reminded him that he didn't have to participate in the decision making and that he could just let her be the doctor and focus on himself. He ended up taking her up on this offer. So even between the same patient and doctor, the relationship varied. One of the best books I've ever read. That was a great book. It moved me deeply. I haven't cried that much over a book since. I'm an ER doctor, and sometimes I have other doctors as patients. For the most part they're pretty good patients because they can give a good description of their symptoms in a way that's useful to me. They usually ask good questions and are well equipped to have an informed discussion about their diagnosis and treatment. Sometimes it's hard for me to dial back my patient talk where I simplify medical terms for laypeople. Sometimes it's challenging if their area of expertise is totally unrelated to the issue at hand and they don't recognize their limited understanding. The worst patients are those who have just a little medical knowledge and think they know everything. Some version of, my aunt is a nurse, and she said I need a whole body MRI for this runny nose. As far as self-diagnosing, I usually deal with my own minor medical issues. If I notice signs of something more serious, I would go to someone else. As a veterinarian, many of my worst clients are nurses and doctors. Lots of questionable home diagnoses and treatments. Yeah, people and animals are pretty close, but we're not the same and medicines don't work 100% the same. I agree about having difficulty dialing back the patient talk though. These are folks that can understand medical terms, and I don't want to be demeaning, but I've got my dumbed down spiel about things and it just flows out. To be fair, I recognize that I'm probably annoying to my doctor too. Although when I went in for surgery last year I had a great time chatting with the anesthesia nurses about protocols until they drugged me. I'm also a vet, and I usually don't even tell my doctors what I do. I once let an endocrinologist go through a whole explanation of what hyperthyroidism is to me because I didn't want him to accidentally skip over something that's different between humans and cats. Turns out it's pretty much the same. And in the end I don't have it. That's a good point about them maybe skipping over something relevant. I never really considered that. Even between different species it's different. My dog developed pancreatitis. The cause was he was having a bit too much fat from human foods. All we had to do was stop feeding him scraps. My cat developed pancreatitis. They don't know what specifically causes it in cats. Could literally be a multitude of things, all terrible. So he had to get hospitalized for a couple days. Just got him tonight. He has a feeding tube. Cost me $7,000. All to be told, yeah, so we still don't know what's really wrong with him. Good luck. Aw, really? I usually let a new vet go on inpatient talk for a couple minutes and eventually interject to let them know I'm a pathologist, and usually they relax into shop talk. My cat's new dermatologist even, in her words, nerded out and gave me a big lecture on the anatomy of the feline middle ear. She kinda lost me. It was over the phone, THX COVID, but was super interesting. That stuff is fun. I love getting to be a little nerdy with the medical folks. I just don't like the questionable home diagnoses and treatments. If you avoid those things, you're good in my book. I had a client dog eat a wild mushroom in his own garden. I was just dropping the dog off for the evening, owner's due back in 2 hours. I let the human doctor, client know, and she said to leave him and she was sure it would be fine, and cursed for getting to pull up those wild mushrooms. I took him to the vet anyway, kind of without her blessing since she said to leave him, but I knew she would be fine with it. They did the whole vomit injection thing, and she met me there to pay the bill and take him home. She thanked me profusely and told me how much she appreciated me making the call to take him in when I knew better, in spite of her suggestion not to. She also described something as a doggy cold, said the vet said that, I think she meant kennel cough? Last week. She's definitely one of those doctors who 100% realizes that she is a human doctor, not a veterinarian, and that she has huge gaps in her knowledge, and that's okay. Interesting you should say all of this. I was reflecting on my visit to the vet recently, and realized I was probably annoying to them. I'm a PA. So I plan on being more mindful going forward. And I've certainly had vets and dentists who were pains in the ass. I don't mind scientific questions and medical talk, that stuff is really fun. I mostly just mind when people self-diagnose and treat. Things like, you're probably doing the right thing for if this was a human, but this is a cat. And for goodness sake, you're a physician, be a little compliant, please. When I drop my dog off at the vet, she is always surprised that I'm shocked that some of the same medicines work on humans and dogs. I feel like veterinary medicine is so much harder than the medicine that I practice. We do share a lot of the same medicines, a lot of it is just changes in dosing. I understand dosing for thyroid medicine is very different in people and pets, which causes a lot of confusion. And things like Benadryl. A 100 pounds human takes one twice a day, a 100 pounds dog takes 4 to 3 times a day, so that kind of stuff, even to lay people, can be difficult to assure them that yes, I meant 4 tabs, no you won't kill your dog, no giving your Mastiff half a Benadryl isn't going to help it. I was looking up a veterinary-specific antibiotic the other day to see if a patient/client could get it from a human pharmacy, and found out that we don't give it to people because it causes hallucinations, of the bad variety, apparently. I hope I'm not making my patients hallucinate. None of them seem too bothered by it. Going even further, smaller animals also sometimes have the same medications, just a much smaller dosing. My guinea pig needed a medicine that was only made for dogs, but the vet just prescribed 1/10 the normal dose. Pretty neat. I've always suspected that small dogs are really just several guinea pigs in a trench coat. Specifically about thyroid medication, the difference in doses is indeed quite significant. We would usually call in a prescription to whichever pharmacy the client preferred, but there was one specific one that we hated using if it was thyroid meds. The pharmacists that worked there always called us back to check the dosage, even after we, the assistants, and even the doctor explained to her many times, yes, I know it sounds like an overdosage, but it's a dog. This behavior finally ended when we found out that she took it upon herself to change a patient's dosage because she couldn't get a hold of us. The owner brought the dog in to recheck the level, and it was nowhere near where it should be. The client called us back and read off the label to us. It was significantly under dose. When our vet found out, she drove over to the pharmacy on her lunch and lit into the pharmacist. I wish I could have been there. She does not hold back when she is really pissed, and I wouldn't have been surprised to learn the pharmacist cried. If you liked the video, hit that subscribe button for more content. I post every day, and I'll see you next time with more stories.